Jobin Jamson from BSN2E, and I'll be the reporter for today, and I'll be discussing what is cholinergic agonist. Cholinergic agonists act at the same site of neurotransmitter acetylcholine and increase the activity of acetylcholine receptor sites in the parasympathetic nervous system. The parasympathetic nervous system plays the vital role in maintaining both mental and physical health by calming down the body from stress reactions that elevate the blood pressure, dilate the pupil, and divert the energy from other body processes to fighting and fleeing. There are two types of cholinergic receptors. The first one is muscarinic receptors from G-protein coupled receptor complexes in the cell membranes of certain neurons. They act as the main and end receptors stimulated by acetylcholine released from prostaglandinic fibers in the parasympathetic nervous system. The first one is secretion from salivary glands and stomach. Number 2, slow heart rate. Number 3, smooth muscle contraction. Number 4, enhances CNS locomotion. And number 5, is not really known but are present in central nervous system. The second one is nicotinic receptors, receptor polypeptides that respond to acetylcholine muscle type found at neuromuscular junction that controls muscle contraction. Cholinergic agonists are also called parasympathomimetic because they mimic the actions of the parasympathetic nervous system. There are two kinds of cholinergic agonists. The first one is direct-acting cholinergic agonists, which directly with cholinergic receptor sites to mimic the effects of ACH and increase parasympathetic stimulation. They are systemic agents used to increase bladder rate, urinary excretion, GI secretion, and as ophthalmic agents for meiosis. They are generally well absorbed after oral administration with short half-lives of 1 to 6 hours. Some drugs example are vitanicol or choline ester. It is very stable, orally active, and used to stimulate GI tract and urinary bladder after surgery. Number 2, carbachol. It is a long-lasting ophthalmic agent which is used to induce meiosis or pupil constriction, and a topical treatment for glaucoma and resistant to hydrolysis. Number 3, cevimeline and pilocarpine or alkaloids. Bind to muscarinic receptor used to counteract symptoms of Sjögren's syndrome, which is characterized by mouth. Contraindications. The direct-acting cholinergic agonists are contraindicated with persons who have bradycardia, hypotension, vasomotor instability, coronary artery disease, peptic ulcer, intestinal obstruction, asthma, bladder obstruction, and epilepsy. Drug-to-drug interaction, increased risk of combined with acetylcholine esterase inhibitor such as neostigmine or tacrine. The second one is indirect acting cholinergic agonists that react with acetylcholine esterase in the synaptic cleft to prevent the breakdown of acetylcholine and prolonged stimulation of acetylcholine receptor sites. They are generally called acetylcholine esterase inhibitors and divided into two major classes. The first one is reverse short-acting agents, which are principally carbamates, carbamic and acid esters. Irreversible long-acting agents, which are principally organophosphates such as isoflurane and ecothiopate. The two main categories of reversible indirect acting cholinergic agonists are treatments for myasthenia gravis and Alzheimer's disease. Myasthenia gravis is an autoimmune disease characterized by a defect neuromuscular transmission as patients make antibodies to acetylcholine receptors, therefore causing destruction of acetylcholine receptors and eventual loss of response at the neuromuscular junction. This disease is marked by progressive weakness and lack of muscle control.
First, we need to look at motor nerves and how they communicate with muscles. And this is done at something called the neuromuscular junction. At the neuromuscular junction, axons of the motor nerves are situated across a synapse from the postsynaptic membrane on the muscle cell. The axons release a neurotransmitter from the presynaptic membrane, and this neurotransmitter at these junctions is called acetylcholine. And this acetylcholine travels across the synapse and attaches itself to receptors on the postsynaptic membrane. The acetylcholine stimulates the receptors, and this leads to muscle contraction. So in order for the motor nerves to communicate with the muscle cells, they need to release acetylcholine, and this needs to bind to receptors on the postsynaptic membrane. In around 85% of patients with myasthenia gravis, acetylcholine receptor antibodies are produced by the immune system. And these antibodies bind to the postsynaptic neuromuscular junction receptors, or the acetylcholine receptors, and they block the receptors. And this prevents the acetylcholine from being able to stimulate the receptor and trigger muscle contraction. As the receptors are used more during muscle activity, more of them become blocked up. And this leads to less effective stimulation of the muscle with increased activity. There is more muscle weakness the more muscles are used. This improves with rest as the receptors are freed up for more use again. These antibodies also activate the complement system within the neuromuscular junction, and this leads to damage to the cells at the postsynaptic membrane, and this further worsens the symptoms.
The drug of choice is to distinguish myasthenic crisis or very intense phase of myasthenia gravis and cholinergic crisis or respiratory muscle involved. A droponium injection wherein if the patient improves after administration, it is myasthenic crisis. However, if the patient gets worse, it is cholinergic crisis, and intense medical support is needed. Neostigmine and pyridostigmine are the example drugs that are used for the management of myasthenia gravis to increase muscle strength. Alzheimer's disease is a chronic and progressive disease of brain's cortex involving neural degeneration that leads to marked loss of memory and of the ability to carry on activities of daily living. This primarily strikes the elderly, and it's known that there is progressive loss of acetylcholine producing neurons in the cortex, which are vital in allowing connections between our thoughts and stimuli. There are 4 types of reversible indirect acting cholinergic agonists available to slow the progression of disease, and they are more readily cross the blood-brain barrier to increase the acetylcholine where acetylcholine producing cells are dying. These are tacrine, galantamine, rivastigmine, donepezil, and memantine. Pharmacokinetics. Neostigmine or synthetic 2 to 4 hours short acting. Pyridostigmine longer duration of actions 3 to 6 hours and oral and parenteral. Avenomium oral or 3 to 6 hours. Edrophonium IV very short duration 10 to 20 minutes. Tacrine is a capsule that 2 to 4 hours half-life. Galantamine tablet 7 hours, rivastigmine capsule solution and transdermal 12 hours, donepezil oral 70-hour half-life. Contraindication must not be taken with bradycardia, urinary tract obstruction, pregnancy, during lactation, peptic ulcer, asthma, arrhythmia, epilepsy, hepatic or renal dysfunction. These are the cholinergic adverse effects: diarrhea, urination, meiosis or muscle weakness, bronchorrhea, bradycardia, emesis, lacrimation, salivation, and sweating. I hope you learned a lot from this video. Thank you for watching!